Hey Alpha Nurses, I'm Licensure from alphanursguy.com. This is 5 NCLEX questions. Without delay, let's get started.
A healthcare provider prescribes 0.5 milligrams of protamine sulfate for a client who is showing signs of bleeding after receiving a 100-unit dose of heparin. The nurse should expect the effects of the protamine sulfate to be noted in which of the following time frames? 1. 5 minutes. 2. 10 minutes. 3. 20 minutes. 4. 30 minutes. The correct answer is 3. A dose of 0.5 milligrams of protamine sulfate reverses a 100-unit dose of heparin within 20 minutes. When a client with thrombocytopenia has a severe headache, the nurse interprets that this may indicate which of the following? 1. Stress of the disease. 2. Cerebral bleeding. 3. Migraine headache. 4. Sinus congestion. The correct answer is 2. When the platelet count is very low, red blood cells leak out of the blood vessels and into the tissue. If the blood pressure is elevated and the platelet count falls to less than 15,000 microliter, internal bleeding in the brain can occur. The nurse should instruct the client with a platelet count of less than 150,000 microliter to avoid which of the following activities? 1. Ambulation. 2. Valsalva's maneuver. 3. Visiting with children. 4. Semi-Fowler's position. The correct answer is 2. When the platelet count is less than 150,000 microliter, prolonged bleeding can occur from trauma, injury, or straining such as with Valsalva's maneuver. The nurse should assess a client with thrombocytopenia who has developed a hemorrhage for which of the following? 1. Tachycardia. 2. Bradycardia. 3. Decreased PaCO2. 4. Narrowed pulse pressure. The correct answer is 1. The nurse observes tachycardia in the hemorrhaging client because the heart beats faster to compensate for decreased circulating volume and decreased numbers of oxygen-carrying red blood cells. When teaching the client older than age 50 who is receiving long-term prednisone therapy, the nurse should recommend which of the following? 1. Take the prednisone with food. 2. Take over-the-counter drugs as needed. 3. Exercise 3 to 4 times a week. 4. Eat foods that are low in potassium. The correct answer is 1. Nausea, vomiting, and peptic ulcers are gastrointestinal adverse effects of prednisone, so it is recommended that clients take the prednisone with food.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.